Now I discuss about the common mistakes we do while examining a hernia. If the examiner asks to do deep ring occlusion test, first we have to reduce the hernia and ask the patient to lie down and reduce the hernia by taxis, and after that we locate the deep ring. And usually location of deep ring is between symphysis pubis and anterior superior iliac spine. We can reach the symphysis pubis in 3 ways, and if the patient is not obese, is thin, we can locate it by coming down from above umbilicus straightly to the symphysis pubis, or otherwise we can follow the inguinal ligament and wear and feel for the pubic tubercle, and then medial to the pubic tubercle is the pubic symphysis. If the patient is obese, then we will do that adductor longus tendon taut by asking the patient to internally rotate against resistant. So the adductor longus will become taut, and this adductor longus taut tendon followed up to the pubic tubercle, and there it inserts, and then we will feel for the pubic tubercle and again go medially for the symphysis pubis. And this mid-inguinal point, it is 1.25 centimeters above the inguinal ligament, deep ring is. And same 1.25 centimeters below the inguinal ligament is, we will palpate for femoral pulse against neck of femur. And after locating this deep ring, and we will occlude with the thumb of the hand at the deep ring, and simultaneously we will stabilize the pelvis by holding on opposite side, so that then we ask the patient to cough, and after that we ask the patient to stand while keeping the thumb at deep ring, and after standing we ask the patient to cough again, and we look for the swelling, any swelling appearing or there or not. And the common mistake we do here is, we don't ask the patient to stand. We should ask the patient to stand. That is also very important. Here coming to the hydrocele. In hydrocele, getting above the swelling is, the examiner if asked, we should keep our thumb and fingers, and we should palpate with them at the root of scrotum. Don't just put your fingers above the swelling and say that the getting above swelling is possible. We should not do like that. The thing is, after keeping your thumb and fingers at the root of scrotum, you should roll your fingers for feeling of cord structures, whether they are whether you are able to appreciate them separately or not. We should feel for them. The examiner will observe that. Don't just keep your fingers above the swelling and say getting above is possible. You have to roll your fingers for palpating cord structures. If you are able to palpate cord structures separately, then only you say that getting above swelling is possible. And also in case of other hernias, ventral hernias, incisional hernias, any umbilical hernia, in the ventral hernia is limited to the incisional hernias usually, but and any abdominal wall incisional hernias or epigastric hernia, for palpating defect, we should ask the patient to head rise or leg rise, then make the muscles, abdominal muscles taut, and then feel for the defect. That you should do. The examiner will ask, how do you palpate the defect of epigastric hernia or ventral hernia or incisional hernia. And one more thing about epigastric hernia is, here epigastric, we think that epigastric hernia is midline, but not that. 80% of the epigastric hernia are of the midline. They usually occur through the openings of para-midline vessels or nerves. And also epigastric hernia is also called as fatty hernia of linea alba. And the peculiar thing here is the content of epigastric hernia can be extra peritoneal pad of fat also. And in hernia, one more thing we have to know is Gibbon's hernia, means hydrocele of hernia. Here the peculiarity of this hydrocele is because of the adhescence of hernial content among themselves and to the wall of the sac, there will be occluded sac, so the all secretions from peritoneum will be accumulated in the sac, so that will lead to the hydrocele of hernia. But the reason here hydrocele is the secretions are from peritoneum, and the normal hydrocele is secretions are from tunica vaginalis. It can be due to secretions like in secondary hydrocele, or it can be due to defective absorption due to subclinical infection. Defective absorption by the tunica vaginalis due to subclinical infection. But here the difference is the secretions are from peritoneum. And one more thing here is hernia of hydrocele. Hernia of hydrocele means if the hernia is huge and due to that gravity or pressure, the hydrocele will pierces through the torn dartus muscle and comes to lie under immediately below the skin. That is called as hernia of hydrocele. While you are examining a hydrocele, you should palpate it all around for knowing whether it is herniated or not. Here about hydrocele types, there are two types: funicular hydrocele, congenital hydrocele. These will have the connection with the peritoneal cavity. The congenital, what is the difference between congenital and funicular hydrocele is the funicular hydrocele will extend up to the root of scrotum only, but congenital it can extend up to the tip. But in congenital hydrocele sometimes we feel like it is not getting reduced on lying, it is not getting reduced sometimes because of the reverse incubatal effect, it will not reduce. And funicular and congenital hydrocele are the types of hydrocele that are having connection with the peritoneal cavity. And one more type of hydrocele is infantile hydrocele. In this infantile hydrocele, the hydrocele will extend up to the deep ring but will not have any connection with the peritoneal cavity. But name here is saying like infantile, but it doesn't mean that it occurs only in infants. It can occur in adults. And one more type of infantile hydrocele is if the infantile hydrocele is getting increased in size and becoming huge, then it will escape into through the layers of muscle of abdomen, or it can go into the retroperitoneum but not into the peritoneal cavity. And if it escapes like that into the layers of abdominal wall or into the peritoneum, it will look like bisac, and it is having two hydroceles. Beyond the deep ring, one hydrocele, infantile hydrocele, and beyond that deep ring into the abdomen, one more hydrocele sac. It is called as hydrocele n bisac. And here one more confusion is sliding hernia. Sliding hernia is called as hernia en glissade. Till now I told about hydrocele n bisac. Hernia en glissade is sliding hernia. Hydrocele n bisac is the complication of infantile hydrocele, or the most common theory the proposed is that Complications of hydrocele include infection, hemorrhage,